Good morning, everyone. We would like to welcome all the people who are joining the regional R4V Platform webinar about good practices in the implementation of the victim-centered approach and interagency complaints and referral mechanisms for cases of SEA committed by personnel of R4V partner organizations. This webinar was organized by the R4V Regional Community of Practice for Protection from Sexual Exploitation and Abuse, PSAS, which is a cross-cutting group of the regional platform co-led by UNHCR, UNICEF, and IOM. We are very pleased to present this webinar, which comes as a direct response to the request for technical support that the platform's partner organizations channeled through the regional mapping exercise that we carried out at the end of 2020 and in July this year. My name is Mónica Noriega. I'm the co-leader of the Community of Practice on behalf of IOM. And before we begin, I would like to introduce the panelists joining us this morning and the other co-leaders of the Regional PSAS Community of Practice. We have a spectacular panel for you. As panelists, we have Catalina Arciniegas, who is joining us today from Bogota. She's the PSAS Network Coordinator. We have Ivana Habchakova from New York. She is a child protection specialist for UNICEF. Mariska de Kiersmaker, who is in the IOM PSAS officer in Geneva. Tim Howe from Panama, who is the R4V Regional Coordination Platform co-coordinator. Maria Chiquitano, who is based in Bangkok and joining us from Italy. She is the regional coordinator of Asia and Pacific Interagency PSAS Task Force, and Amit Sen, who is joining us from Geneva, and he's the senior PSAS Interagency Coordinator from UNHCR. And we are also joined by the co-leaders of the Regional Community of Practice, Valentina Duque from UNHCR and Catalina Fernandez from UNICEF. Again, a big thank you to our panelists for sharing their experiences with the 17 countries that are part of our response. And without further ado, I give the floor to Tim, coordinator of the R4V platform, to start this very important and enriching session. Thank you.
First of all, let me maybe start by thanking all of the panelists that we have here today from UNHCR, from UNICEF, IOM, the Interagency PSAS Task Force in Asia Pacific, and of course our colleagues in Colombia from the PSAS network. Allow me, just following up on Monica's introduction, to also really express a very big thanks, and they wouldn't say it themselves, so I have to say it, to Valentina, Catalina, and Monica for putting this together on behalf of 159 R4V members, because that's how many members we are within this humanitarian forum. So thanks so much, everybody, for joining today. A little bit on the background on the platform, and perhaps thank you so much for inviting me and giving me the opportunity. I should say we're two coordinators of the regional platform. My counterpart from UNHCR, Philippe Sacher, cannot be with us today, but he sends his regards, and he was on the last session that we also organized around the same time last year. A little bit of background on what is the regional platform and how does this meeting fit in, and why, as Monica said, this meeting is so important and so timely for us. So the Regional Interagency Coordination Platform for Refugees and Migrants from Venezuela is a humanitarian forum for the response to assist refugees and migrants from Venezuela, as well as affected host communities. And so the platform works and coordinates the activities of 159 humanitarian and development actors in 17 countries in the region. So with that, it's actually one of the biggest humanitarian response mechanisms that we know in the world. It is further to a mandate given to us, to a direction given by the UN Secretary General back in 2018 to UNHCR and IOM to co-lead this humanitarian coordination response. And since then, it has become known as R4V. And really, it has become a very significant form. We see it each year growing. And just right now, I started by saying this is a very timely moment for this webinar, because just now, actually just this week, we opened a window for submissions under what will be the next regional refugee and migrant response plan. So it's very timely in that respect, because we also expect that we will actually have new members joining as part of it, working in all of the 17 countries. So linking back to PSAS, PSAA is extremely important for us, not only as a transversal commitment that we've all signed up to as individual agencies, but really also as a collective commitment we have to guide our planning and programming. So this is where we have had to invest quite a bit of work over the past years, and we feel like we've come a long way. One of the key elements that we initiated last year under the leadership really of UNHCR, UNICEF, and IOM was to do a very thorough mapping of PSAA practices in the region. We know that having a strong response, having PSAA mechanisms is key to keep the trust of the beneficiaries we work for. Under this year's RMRP, we're aiming at assisting 3.3 million people. We know that sexual exploitation abuse occurs when people are in vulnerable situations. We also know it occurs when there are no accountability complaint mechanisms in place. So this has been a very big concern to us. We have a massive responsibility collectively as 159 partners working under the R4V response to address this. And this is actually something that we also found reflected in the mapping, which gave us a lot of very good points, a lot of promising practices in the region. And we're very happy to have colleagues from Colombia as one of the key countries really of the response represented today, also to share with us exactly some of the good practices that we already have in the region. But we're very aware that there are many things that we need to improve. And so again, panelists, thank you so much for joining from all these different places, because we need to hear from you. We need to upscale our response quite a bit, and we want to really replicate the good practices. Very quickly then, the mapping that we did gave us 6 key priority areas. And this in a way is important because now we have a basis to check in regularly, to monitor ourselves, to see have we improved on all of these areas. The first priority that we have, and that is being reflected in our current RMRP planning for the RMRP 2022, is to conduct joint needs risk assessment next year in all of the 17 R4V countries. The second one is to support all our platform partners, and again, 159 spread across 17 countries, so it's a big group, to ensure that we all have the organizational policies, strategies, and guidance needed to prevent PSAA, to prevent SEA. And to develop, in this sense, a strong network of dedicated PSAA focal point under the R4V response, but always in harmony with other frameworks and mechanisms that we also have in this region. This, I think, is a key point for us. The third key objective that we have is to ensure effective and comprehensive mechanisms related to the awareness raising around SEA amongst all R4V partners. Again, this webinar today is part of that, right? Like we need to keep raising awareness, and what better way we have by really broadening the debate and bringing in more and more people. And so we hope that many people will watch this today, and we will give this a very prominent spot also on our R4V webpage. Another one is another objective, the fourth one, is to strengthen the engagement with and support to affected populations. And here maybe just a note to say this year is the first year that we have a PSAA and AAP guidance note for the development of the RMRP as a planning guidance structure. This is the first time we have it. Our PSAA team and AAP focal points have worked hand in hand. And we have a lot of dialogue also with representatives of the dialogue going on in the region. So we think we are on a very important path here. The fifth one is to support partners' internal complaint mechanism, which every agency and partner, of course, should have. And we want to support that. But we also want to strengthen what is interagency, going beyond one agency and really stressing what is the focus of R4V, which is the interagency coordination between us. Last but not least, the last objective, and this really brings us back to the webinar, and then I promise I'll be very quiet and we really want to listen to all of you. But the last objective is to facilitate access to victims' assistance. And maybe here we have a number of the RMRP and the platform works in a sectorial structure. So I should highlight, we have 2 very important subsectors under the protection sector, the GBV and child protection sectors, which we think have been doing a lot of work on that to maybe add also the trafficking and smuggling sectors. But again, it's intersectorial work. But how can we facilitate access to victims? To victims, really? How can we make their voice heard? And we feel like from the mapping, and I think we might hear a little bit more about this, but from the mapping that we did, which really had a very strong buy-in and a lot of participation and feedback from all our 8 platforms representing the 17 countries, we feel this was identified consistently as a bit of a gap. And Philippe and me, we were recently in Colombia traveling there. One of the elements that really came out was people kept on asking us, what can we do more to really establish interagency complaint mechanisms and have victims assistance procedures, including referral, right? And where we can see again, where does the complementarity that we have from all the partners that work with us, how can we capitalize on that? So I promise I don't want to take up too much space, because this is perhaps exactly where we want to hear from all of you panelists, on good practices, on your suggestions, on key standards. How can we improve on that? We'll be listening. I'll be listening very attentively. And again, we really thank you for being here today, taking out time out of your busy schedules. And I pass the word to the next panelist. Thank you so much.
Thank you very much, team. Perhaps this is a good time to say something very important. The webinar is going to be divided into 3 sections. The first one is going to be led by global experts who will tell us about good practices in the operationalization of PSEA guiding approaches, the key concepts of victims assistance, and the development of interagency mechanisms for reporting and referring SEA complaints. And the second section is going to be led by 2 PSEA coordinators, and through their interventions, we will have the opportunity to learn from the lessons they have learned in the process of building PSEA interagency mechanisms, one in Zimbabwe and the other in Colombia. And finally, the third section is going to be a Q&A. And without further ado, and to start with the first section of experts, we invite Amit Sen to share with us what the survivor or victim-based approach means in practice, especially when it comes to interagency PSEA efforts.
Thank you so much for the opportunity to be with you and to share some of the work we're doing, both internally and interagency. So in 2020, UNHCR issued formally a policy on a victim-centered approach in UNHCR's response to sexual misconduct. So for us, it was very important to cover both sexual exploitation and abuse, as well as sexual harassment between humanitarian personnel, because we see these forms of misconduct as sharing root causes of the abuse of power, gender inequality, and the abuse of authority. In terms of why we actually did this, we had a few key purposes. The first of which is to define and to clarify what we mean by a victim-centered approach. We noticed that we often see this term being used, being referenced, appearing in documents, but it's not always clear exactly what we expect and exactly what this entails. Secondly, we wanted to reaffirm our commitment institutionally very clearly that this approach is in fact policy, and it is binding for our response and approach to all allegations of sexual misconduct. And we need to clarify also within this policy, which we have done, who is responsible for implementing the victim-centered approach in practice, which I will get into. But I wanted to start first with the definition that we developed, which now appears in this policy, which is public. The policy itself is public. And it outlines a few steps that culminate in a goal. The first of these steps is listening, to prioritize listening to victims and survivors, to avoid re-traumatization, and to systematically focus on the safety, rights, well-being, and expressed needs and choices of victims and survivors. And this is to give back as much control as feasible and to ensure the empathetic and sensitive delivery of services and accompaniment of victims and survivors in a non-judgmental manner. So if we start looking at it, we came up with 10 key principles that should guide all of the agency's work regarding any and every form of sexual misconduct. And I'd like to briefly go through those principles and then go through who in our agency, which divisions, which entities are responsible, and to highlight some of the kinds of actions that they're actually taking forward in practice and how we're trying to develop further that area of work. So the first element is to prioritize first and foremost protection, security, and well-being. That's first. Everything we do and the way we do it must adhere to the obligation to do no harm. And specifically, this also requires considering security measures that may be needed to address possible risks of retaliation and to avoid survivors being re-victimized and re-traumatized. The second point, it's very important for us, is that assistance and support are never conditional on anything, certainly not on initiating an investigation, on cooperating, providing testimony. It's simply not conditional at all. It is a right. And for sexual harassment, we have established a procedure that I'll describe a little bit more, where the victim is accompanied throughout the process so that they're supported, they're properly informed, and that their options are really as clear as possible in a very supportive manner. We call it an opt-out system because we begin with the provision of that support, and the person can say at any time that they don't want to continue, but the onus, the burden is not on them to go find help. The help is there from the moment that we are aware that there is an allegation. The third principle is non-discrimination, and this is the importance of ensuring that every victim and survivor receives support in line with the victim-centered approach without exception on any basis. The fourth is an end-to-end holistic approach, and what that means is that our responsibility begins the moment we are aware that there could be an incident, a problem, an allegation, and the services are in no way tied or tethered to a disciplinary process. An investigation may end, a disciplinary process may end. That's not the end of our support to the individual or our obligation to support and assist the individual. The fifth principle is to give back control as much as possible. And if there are situations which can arise, sometimes because of safety, sometimes because of security, sometimes because of legal obligations, where we may have to take a step that a victim themselves did not ask for or may not feel comfortable with, we want to explain that upfront as early as possible. Certain steps may be required, even if they aren't the steps you yourself may like to take or would prefer to take. That needs to be explained very transparently. The sixth, coming from that, is confidentiality and informed consent. Again, these terms are used a lot, but they're rarely explained, especially to the people who are most impacted, which is victims and survivors themselves. So we want to explain these rights upfront as early as possible, and really ideally before the victim discloses the entirety of the allegation. So they understand both confidentiality and informed consent, as well as the possible limits to those rights. Seventh, this is an overarching principle, is ask and listen. We have a lot of baggage in culture we still need to work around in terms of gender inequality, patriarchy, victim blaming. It's not going to go away overnight, but we can start by asking and listening without bias, without making assumptions, without a lot of the dangerous cultural baggage, showing empathy and starting at the outset that, yes, this may have happened. Information, again, we have an obligation to keep victims and survivors fully informed throughout the process. And if there is some information that cannot be shared with them, which can happen with investigations, especially because certain elements are confidential, we have to explain what cannot be disclosed to them and why. So again, they have the fullest picture possible. Of course, for children, the ninth principle is to follow the best interests of the child. And that includes the right of the child to be heard in line with the Convention on the Rights of the Child, in line with their age of maturity. And finally, the last principle is due process. Now, in any investigative procedure, to ensure that the investigation is sound, is rigorous, and is trusted, we do have to follow due process. That means, of course, that alleged perpetrators have certain rights as well. But a very, very important element is to explain the due process rights of an alleged perpetrator to victims and survivors, and to clarify how that might affect them, so they're fully aware. Now, going forward, if we can get a little bit more practical, what we've done in our policy is outline each of the entities that actually has to do this in practice. So who is responsible? And it is a binding policy. And if I may, the policy was only issued last year, so we are still, in a way, promoting its operationalization. but I think some very important steps have been taken I'd like to go through very quickly. So one of them, these are the entities that have to essentially implement the victim-centered approach to sexual misconduct. If I can start with the office I work for, this is the Office of the UN Senior Coordinator on SEA and SH. We're very fortunate to have within our team a clinical psychologist, a senior clinical psychologist who is a dedicated victim care officer who does two things. She has a global role. One is she informs all of our work in this area, both SEA and SH, to make sure that it is genuinely as victim-centered as possible and is sensitive to the needs of survivors from a psychosocial and emotional standpoint. Secondly, she provides to every SH sexual harassment victim who wishes it, support and accompaniment throughout the procedure. So whenever a sexual harassment incident is disclosed, the staff who receive that disclosure should be aware, they're trained to be aware that the victim care officer exists as a resource. They tell the victim, this resource is available to you at your discretion. So we try to empower that person to pick up the phone, to make the contact. But once they do, the victim care officer provides psychosocial support as well as an interview, and records that interview, and then advises the individual of the options within the agency. And within the agency, essentially, there is the disciplinary option, which is to go through an investigation that's led by the Inspector General's office, or an option to go through the Ombudsman's office, the Ombudsperson's office, which is sometimes referred to as the informal procedure. But in both, what's really critical is that they meet with them before any interaction with those mechanisms to really support them and explain what steps will be taken so that there aren't any surprises. They're present with them if the victim chooses during any meeting or any interview with the Inspector General or with the Ombudsperson. And they also debrief with them afterwards. They also, in the context of if the individual elects to go through the disciplinary process, they're also there to really look at protective measures, which is very important. So that could include, in the context of sexual harassment, changing the supervisor if the individual doesn't feel safe going through that process with the current supervisor, potentially changing the office layout so they don't have to interact necessarily with that person. And they similarly support through what is often referred to as the informal process through the ombudsperson. And there, what often happens is there's either a mediated conversation with the ombudsperson and both the victim and the perpetrator, as well as the victim care officer, or there's something we call shuttle diplomacy, where the victim doesn't want to directly be present with the offender, with the perpetrator. They want the communication to go back and forth, but their main points are taken forward. And very often that can reflect sentiments like there has been a violation of trust. The perpetrator needs to understand the power and authority that they hold and the importance of using that authority responsibly, and also to appreciate the impact that may have had at the personal level. But in most situations, what our victim care officer reports back is through that process, there is a positive resolution, and perpetrators do acknowledge the harm caused and do apologize, and there is a good prospect for improved conduct going forward. We've talked a little bit about investigations. Now, of course, investigations can cover for us both sides of misconduct, both sexual harassment and sexual exploitation and abuse. Our Inspector General's office, in line with this policy, is also developing internal guidance on a victim-centered approach to investigations. And some of those elements, really critically, include very affirmatively informing survivors always that they have a right to choose the gender of the person that interviews them. They have the right to elect a female investigator. They have a right to request a change in the time and the place of the interview to make sure that it is secure and comfortable and confidential as possible. And in a really paramount manner, they have a right really to determine whether the investigation proceeds or not. We will not investigate against the wishes of an adult survivor. So really want to, the greatest degree possible, as we said, return control, understanding that it's a complex process. There are some legal requirements around mandatory reporting, but to the extent possible. Another really key player, if I may, is the Division of International Protection, commonly known as DIP. This is the entity at headquarters that supervises our global work on gender-based violence and child protection. And within the GBV work, one of the things that they've done is they've launched, through a program called Safe from the Start, I'm sure many of you are aware, a global GBV risk mitigation mainstreaming learning program. So this is about developing safer programming in consultation with local stakeholders, in consultation with affected people, particularly women and girls. And a large part of that GBV risk mitigation is SEA risk analysis and risk mitigation. So this program was launched in 2018, and from 2018 to 2021, close to 600 participants have been trained, so almost 400 women and 200 men, from multifunctional teams that include program, management, protection, technical sectors, from about 45 operations, okay, in all regions that we currently work in, which for UNHCR is 7 regions. One of the key things that they've emphasized is better examining safe procedures for the disclosure of GBV, including SEA, and including that, and ensuring that we have clarity and safety on how to facilitate referral to service in line with the informed consent of the survivor. And building on these trainings, which we've set up in quite expansive, a number of operations have developed action plans to mainstream GBV risk mitigation that specifically address identifying and reducing the risks of SEA. And those include Pakistan, Libya, Thailand, Peru, and the Central African Republic. And some of what they're doing is better integrating PSEA and GBV community awareness activities, both for children and women. That's something that's a large part of the effort in Pakistan. Engaging more with non-GBV specific actors in other technical teams and sectors such as site management, shelter, WASH, and health, to better engage them on ensuring their programs are safe with respect to potential SEA risks, and really re-engaging with communities to ensure that complaint and feedback mechanisms are not only accessible, but safe and trusted and appropriate to context, community, and diverse needs. So this is a policy that was developed in 2022. Another thing that we're doing together with our Division of International Protection is really trying to map country by country and operation by operation the extent to which we are meeting SEA survivors' needs through GBV case management, as well as child protection case management when SEA is committed against children, and the SOP calls for that to be essentially managed through the child protection subsector and subcluster. So it's something that's under development, and we also look forward to learning from good practices and emerging practices from others. But these are some of the key areas where we're moving forward. Thank you.
Thank you very much, Amit. I think you touched on some very important points about something that is a big priority right now for the platform, which is risk mitigation regarding investigations that are sensitive to the preferences and the needs of the survivors. Thank you for reminding us that it is precisely the victims and their rights, capacities, needs, preferences, the reason why and for whom we carry out all the actions aimed at preventing and responding to SEA. I think you gave us a very good lens through which we can analyze the rest of the good practices that will be shared. And as Tim mentioned, in addition to prevention efforts, we know that working in parallel to ensure a robust response to SEA cases and guaranteeing assistance to victims is key. What does ensuring victims' assistance mean, and whose role is it within an interagency response? For that, I am going to move on to our next panelist, Ivana. The floor is yours.
Thank you very much, Monica, and thank you, Amit. So I will just preface by saying that the core principles of victim assistance that Amit described in the beginning are also part of the UN protocol on the provision of victim assistance to victims of sexual exploitation and abuse. And so what I will cover and what I will be discussing is based on the framework for the victim assistance based on the UN protocol. So in terms of victim assistance, providing basic services and support to anyone harmed by sexual exploitation and abuse is part of the UN comprehensive approach to victim assistance. The assistance provided should be survivor-centered, as Ahmed explained, and that can mean driven by the individual needs and wishes of the victims. In terms of the assistance, the UN protocol reflects a comprehensive, holistic approach to the provision of assistance and gives clear guidance on basic services that should be provided to all victims. All organizations have a responsibility under the protocol to ensure that victims of SEA perpetrated by their personnel receive immediate assistance. And this can include referring them to appropriate, supportive, and competent service providers, which can include any of the following: the health, psychosocial, security and protection, legal and justice, as well as economic and livelihood support services. This is in line actually with the existing work that's already being done around GBV and child protection programming. And the assistance should be based on the existing services and existing GBV and CP referral pathways in contexts where these exist. Then in terms of these services can include, for example, emergency assistance such as urgent medical care, including clinical management of rape, prenatal, postnatal care, safety and security, for example, relocation to a safe location or safe shelter, provision of dignity kits to women and girls, also food, clothing, and other basic needs, and transportation to access these services and safe shelter. Important to also note that the protocol states that the provision of basic assistance and support should begin upon the receipt of the initial complaint. And also to know that the victim does have a right to decline or refuse assistance or support at any time, including after they have begun to receive it, and that this decision should not impact their ability to access services at any other point in the future or at a later stage as they decide. If case management is available in your context, in your country context, and the victim would like to access these services, then longer-term assistance can be offered, and that would be coordinated through the GBV case management service provider, which can include comprehensive healthcare, psychosocial support, including the higher-level specialized mental health, access to legal assistance, skills training, and education for children. Then in terms of the specialized services or the services and support for children born as a result of SEA, the same specialized services apply to victims who get pregnant and to children born of SEA. In such cases, the UN should facilitate the pursuit of the claims of paternity and child support or nationality or citizenship in line with the wishes of the victim. The concerned UN agency should also refer victims to legal assistance and can link them with the appropriate officials in the country where they wish to pursue or bring their claim. Also, just to know that in cases where the victims decide or choose to pursue investigation and participate in accountability processes, they may need some specific or additional forms of assistance. And that could, for example, include psychosocial support before, during, and after an investigative interview or process. accompaniment by a caseworker during the investigations, logistical support such as translation or transportation for interviews, as well as accommodation measures for children and for persons with disabilities. In regards to the protocol and the roles and responsibilities, the implementation of the Victim Assistance Protocol relies upon the interagency coordination structure in the country, and the protocol sets out clear roles from the highest or most senior level to ensure strengthened accountability on victim assistance and the effective coordination and integration of the assistance into country-level frameworks. So this table describes the proposed actions that need to be engaged on victim assistance at each level, where these positions exist, because not all of the positions may exist in every country context. So these actions are actually complementary to the overall UN system-wide roles and responsibilities on victim assistance that are outlined in the protocol itself. So starting from the highest level, the senior-most UN official has the ultimate responsibility on interagency PSAS work in country, and that includes the implementation of the Victim Assistance Protocol. The HCT, or the humanitarian country team, and the UN country teams at the strategic level are chaired by the resident coordinator or humanitarian coordinator, and includes the heads of the organizations. So the senior level body holds the primary accountability, decision-making, and oversight for PSAS activities at country level. Then the individual UN agencies, funds, and programs are responsible for the provision of assistance to any victim of SCA perpetrated by their own personnel, and where appropriate by the personnel of their implementing partners. In contexts where there are critical gaps in services, and we do have those countries or contexts where some specialized services may be inadequate or completely lacking, then UNICEF for the UN system is the provider of last resort for child victims, and UNFPA is the provider of last resort for adult victims of SCA. Then as we get to the technical and operational level, the PSAS coordinator provides technical support and coordinates with the PSAS network and GBV and Child Protection subclusters, or if they're called working groups, on the provision of the interagency assistance to victims and to address any gaps in assistance coverage. And also engages with the PSAS network with the support of the agency co-chairs to integrate the GBV and CP referral pathways in the PSAS network SOPs, the standard operating procedures. The coordinator also works with the PSAS focal points from the UN agencies, as well as the NGOs and implementing partners and other actors to raise awareness on victims' rights and available services. So these are the overall core requirements and responsibilities of all the actors at country level. And then as R4V, a multi-country platform, I guess you would want to come together as members to discuss what you need to do together for PSAS, and how does the R4V platform support or can support the rollout of the protocol as part of its responsibilities for PSAS. So we'll pause here, and over to you, Monica.
Thank you very much, Ivana, for helping us understand those main elements of victim assistance. You mentioned some very important issues concerning the responsibility that we have and how, as R4V, we can move in the direction of operationalizing our roles and responsibilities regarding PSAS, bearing in mind the specificities of the situation in the region and always maintaining close links with existing PSAS mechanisms. So guaranteeing victim assistance packages is definitely a joint effort in which the child protection and gender-based violence subsectors will also play a very important role, and we hope that we will be able to share good practices that result from the operationalization of the protocol here in the region in the future. Mariska, I would like to build upon the excellent presentations by Amit and Ivana and ask you two questions based on the good practices identified globally. The first question would be, what are the mechanisms that can help us ensure that affected populations have access to SEA reporting and that the complaints they make effectively lead to immediate safe action from organizations, including guaranteeing access to victims' assistance like Ivana mentioned? And the second question would be, are our internal organization mechanisms enough, or must we look beyond them and work collectively to ensure that complaints are acted upon? Mariska, the floor is yours.
Hello, my name is Mariska. I'm very happy to be here today on behalf of the IOM Interagency PSAS project. So we have in IOM a dedicated project, which is quite unique to enhance coordination on PSAS at country level. And so very happy and grateful to be here today to talk with you about how to integrate victim assistance referral pathways in country level standard operating procedures. So what we'll try to do today is to share some good practices, and the aim is really also to replicate this this model within the R4V context, and to provide some tips on how to do that. Let's start out with some challenges. So as we all know, sexual exploitation and abuse is happening in all contexts, and we have a huge problem of underreporting. This list of challenges kind of captures the key issues that we are seeing related to reporting sexual exploitation and abuse, both from a community and beneficiary perspective, and then also an organizational perspective. So just to go through it, very often it happens that communities are not made aware about complaint mechanisms and therefore do not know how to report and do not use complaint mechanisms. There is also the issue of not being able to differentiate what organization the perpetrator works for. And of course, there is the issue of not knowing, not being made aware how to access services. On the other hand, organizations, they have difficulty sometimes with knowing how to refer a complaint or how to send victims to the appropriate services if the victim, of course, wishes to receive services. And then the last one is that most mechanisms and some mechanisms can happen are unable to effectively handle cases of sexual exploitation and abuse. So knowing we have all of these challenges happening in real life, I will present a couple of points at how to address these challenges. So first of all, it's important to have at the response-wide level community consultation that inform the selection of the complaint channels that we use. Knowing how beneficiaries prefer to complain and understanding cultural sensitivities is extremely important. A second A second thing that we can all do in a country response is to have standardized referral pathways that are agreed upon at country level in standard operating procedures. We'll call them PSA SOPs moving forward. And then the third action that is critical to put in place within those standard operating procedures is to integrate gender-based violence and child protection assistance referral pathways. So we call this referral system, is very often also called an interagency community-based complaint mechanism. So when I say a referral system, this means the same as an interagency community-based complaint mechanism, but I'll be using referral system throughout the presentation for ease. The referral system is a very important deliverable of the PSEA program and will be designed by the PSEA network. What is the aim of doing this? We want to make sure that all complaints are properly handled and that during the process, survivors, they receive assistance in line with the UN Victim Assistance Protocol. And then secondly, that this whole process is survivor-centered. This is critical. So having this referral system ensures that organizations can follow up on the allegation that they have in front of them, so they can move forward with an investigation if that's appropriate. And secondly, that the survivors are provided the necessary support that they want. So when talking about a referral system or an interagency CBCM, we are not talking about a new complaint and feedback mechanism, meaning that it is not in itself a new way to receive complaints. It is just linking, it's a system that actually links a variety of complaint channels, including formal complaint and feedback channels set up by organizations, but it can also be community structures, safe spaces, midwives. All these informal community structures can also be using the SOPs to make sure that complaints are referred to the appropriate organization for follow-up, but then also that survivors receive the assistance that they need. I won't go too deep into this because I'm aware that Ivana has already mentioned quite a bit about the roles and responsibilities of key actors. But I just wanted to flag this very useful IASC structure. As you can see, this is specific for humanitarian context, but I'll try to reflect a bit on that as well in the presentation. So why am I showing you this beautiful diagram is because I wanted to take the opportunity to just highlight who will actually be doing the work, right? So who will put this interagency referral system in place? Let's start with the HCT or senior level. So they are really overseeing the PSEA program, should be available for the PSEA network to make sure that if there's any implementation problems, or they should be really there for oversight and support. Then the HC and UNCT, of course, consists of the heads of offices of organizations in every country. And why include them? Of course, because they are accountable to make sure that every organization has the appropriate reporting channels in place that can be linked through the interagency referral system. At the technical level, you'll see that between the senior level and the technical level, you have the PSEA coordinator. We're aware that and I should have said this at the start, that this diagram is of course very, can be adapted for every context. It's not set in stone, it's just a blueprint. So not every context has a PSEA coordinator, but it has proven to be quite beneficial to have a dedicated interagency PSEA coordinator to make sure that the interagency referral system is put in place to support the design, to support the rollout, etc. The PSEA network will be extremely important for setting up the interagency referral system. They will be doing most of the design as the technical body. Just to say that this diagram indicates that it's a PSEA network, but of course it can have a different name. I understood that in the R4V context, we're often talking about platforms. It can also be called a task force. It doesn't really matter, but any technical body consisting of PSEA focal points that can help set up the interagency referral system. And then integral, of course, to all the work that we do should be to involve, consult the affected communities who are the integral partners, of course, of our PSEA program. They should be consulted so the program is culturally appropriate and needs-based, and will, of course, be consulted about the preferences, the reporting preferences, and assistance. So just to recap the slide, key takeaway here is that it is the PSEA network who will create the interagency referral system at the technical level, overseen by the humanitarian country team, UN country team, or whatever other body is in place in your context to oversee this process. It will also be part of the network work plan to roll out the interagency referral system, to raise awareness, to do the trainings. And then it will be the senior level body who endorses the SOPs. Voila. Going to the next slide, I tried to make the slide to just make sure that we can see how related the GBV SOPs are with the PSEA SOPs. Because it's quite an important element of establishing or integrating the victim assistance referral pathways in the PSEA SOPs. Equally, we will need to make sure to integrate the SEA complaint referral pathways in the GBV SOPs. So the linkages between both PSEA actors and GBV, as well as child protection actors, is just so important in integrating services into our referral system. So as Ivana has already said, I'm sorry for saying it again, we are not, as PSEA actors, not trying to duplicate services. We are not providing the victim assistance ourselves. It will be based on the programming of gender-based violence and child protection actors who will be providing the services. But of course, GBV case managers and other service providers, they should be familiar with SEA and with the specific needs of victims or survivors. And so to establish the referral system, coming back to the referral system, it's essential to include the existing assistance referral pathways in the SOPs by collaborating with GBV and child protection actors. And so capturing those referral pathways, it really can be as easy as annexing the GBV subclusters referral pathways to the PSEA SOPs. And then just to say that if there are significant gaps in services, this should, of course, also be addressed systematically with senior leadership, making sure that, services are put in place. And so GBV actors and PSA actors can be very important allies in that regard. I just wanted to take a moment to give a couple, 3 to be exact, a couple of country examples of what we've seen has worked at country level and how the interagency referral system can work in practice. So as you can see, this is just a quick diagram that was integrated in the Afghanistan SOPs that were created or endorsed at least in 2020. So you can see that when a complaint comes in, it can come in various ways, of course, through a focal point, through safe spaces, suggestion box, whatever complaint channels are in place. And then going through making sure that, is the complaint related to SEA? We also have the step of referring survivors for assistance and making sure that the survivors requires assistance, meaning do they consent to getting the services, and then making sure that this is done in a systematic way. The second example is the Mozambique SOPs. They were endorsed in 2021, and here you can also see that various ways to make reports, but in any case, after the report comes in, there is a standardized process, making sure that, of course, the allegation is, I've said it a couple of times already, sorry, is referred to the appropriate organization. But then also here you can see that that survivors are, and I quote, referred for immediate survivor services through the GBV and Child Protection pathways. So that is integrated in this standardized process. The third example I wanted to give you is the Myanmar SOPs that were created in 2020. Also, they're all quite recent, I must say. Here you can also see that they've really integrated the consent and referral pathways through the already existing services. So in case you weren't yet convinced of the importance of having SOPs in place, I wanted to just give a couple of what are the advantages of having such a system created by your network or your platform. First of all, we are, while it's a good practice, of course, to have as many complaint channels in place as we possibly can, we are aware that we won't reach our aim by just setting up different hotlines or other complaint channels. Ultimately, we want to make sure that any survivor can come forward in a safe way and that their complaint can be followed up on, right? So that's why we need the standardized and principled process. It will also be less work, and it will cost less to make sure that all our complaint channels are connected to each other. And building on existing structures and resources is, of course, always a benefit. It's easier, says the slide. What I mean with that is that the collaboration that needs to happen to set up this interagency referral system is really to draft, to agree upon, and to use the complaint referral pathways and the victim assistance referral pathways. So at first, it will be, of course, a bit of work to establish those, but after that, it's a smooth process that is standardized. And lastly, it also creates more accountability and learning. So by using the same definitions, the same principles, we can really start comparing meaningful data on complaint mechanisms. So, okay, you have your SOPs on paper. They are endorsed by senior leadership, which is great. But what now? What do we do now? Of course, looking at this scenario, and this is a real life scenario where you are a program officer, you are speaking with a local midwife during a needs assessment, and she tells you about an incident of SEA, and the victim needs urgent medical assistance, and you are unsure where to send the victim. So what is important here, and what my key message would be, is to not just have the SOPs in place, but to really raise awareness on them. Capacity building is hugely important. So who needs to be capacitated to use this? Preferably everyone in the response. But most importantly, of course, the PSCA focal points, frontline staff who have direct interactions with beneficiaries, and then also project staff running the complaint channels. It's very important that they are aware of that and trained to use them. So our GBV colleagues, and this again goes back to the importance of the linkages between PSA and GBV actors, I keep hammering, is that the GBV colleagues can really support the network on being better at how to speak to survivors, what services are available, and then reversibly, the PSA network can support the GBV subcluster on how to report SEA allegations and on how to communicate what will happen in the next process of investigating the allegation. Here are some, to just finish off, here are some really useful guidance and resources that you would be able to use in your work if you decide within your collective PSA network or platform to establish these SOPs. So if I will definitely share those resources with the organizers of this webinar. And I want to thank everyone for allowing us to present and for the very interesting other presentations. So thank you so much.
Mariska, thank you very much. You mentioned very important topics. The issue of accountability for PSCA within the structure response is something that we have been reflecting on together with UNHCR and IOM, who are leading the R4V response. Promoting these structures at country levels and ensuring that we can work collectively on PSCA requires leadership, technical work. And the role of the PSCA focal points, as you mentioned, is very important. Everything you have shared is very interesting. Thank you. We are also fortunate to have here with us two of the countries that have implemented the mechanisms described in your presentation. So I'm going to move on to the second section of this webinar today. We are going to talk to Maria, who recently finalized SOPs for a PSCA mechanism in Zimbabwe. Maria, what do you think were the main enabling factors in this process, and which lessons learned would you like to share with other regions of the world? Maria, the floor is yours.
Thank you very much to you for the invitation, for this opportunity to be here and to share with all the colleagues and the practitioners on PSCA what we have learned from Zimbabwe. So my name is Maria, and I've been last year the PSCA coordinator for Zimbabwe. I'm presently a regional PSA coordinator for Asia and Pacific, but today I want to talk about what we have done in a very positive way with very positive results in Zimbabwe. The message I really want to share with everybody is that to set a successful PSA mechanism in country is possible. I know that perhaps some of the listeners of this webinar are thinking, no, it's not possible. It's too difficult. We have so many challenges. We have so many problems and so many barriers. No, I want to share with you all the opposite message is possible. And I want to share with you some ideas from a positive experience in Zimbabwe. So first of all, of course, and I know that is happening very frequently, don't give up, even you are feeling like that. And we are feeling like that very frequently, very often. So some basic tips. Yes, we are experiencing every single day a lot of barriers, a lot of challenges, but there's also some tips we can overcome these barriers and these challenges. First of all, create and revitalize, because sometimes it's existing, sometimes you have to start from scratch. But to have a good task force, which should be composed by a small number of competent and motivated colleagues from various agencies, and please, please, please don't forget NGOs, who can provide you advices, support or ideas. And this why, because more brains are working better than one alone. So sometimes as PSA coordinator, we are thinking we can do everything alone. No, it's not possible. We need support. We need colleagues providing us advice, colleagues that we can exchange and we can find better solutions. And a second tip, listen to NGOs, especially national NGOs. These NGOs have mountains of knowledge of field realities. They are our implementing partners, and especially now in the COVID-19 situation. And we know we can't reach the communities. We have very big challenges in being in the field. These NGOs have mountains of knowledge of field reality and barriers to implementation of successful PSA mechanism. They can be extremely helpful to us. And third tip, please prepare a realistic list of achievable results in a clear time frame. When we are arriving in a country and we are the PSA coordinator, we are creating incredible list of results or incredible work plan. Many of them are really unrealistic. No. Please be realistic, and we need really to have achievable results in a clear time frame. And also very important is to create a network of positive relations based on reciprocate trust and support with other agencies, with national and international NGOs. This doesn't mean, be careful on that, doesn't mean that we will become politicians saying yes every time, being a yes man. No, sometimes as PSA coordinator will be obliged to take strong statements and unpopular stance. Don't be scared of that. Is a part of our responsibility. But the most important message I want to share with you all is that PSA work could be extremely, extremely frustrating. And I'm talking from my experience, my personal experience. This is not a theory. I know how much PSA work could be frustrating. We must believe in it. and we must be passionate of human rights and justice and women's rights. Otherwise, okay, maybe a job in administration perhaps could more fit your expectation. But if you want to work in PSA, so you must believe in it. You need some essential condition to have your program successful. First of all, you should have strong support from regional office leadership. Your regional director is a key stakeholder. If this person is not supporting you, your life will be very difficult. But if you have a strong support from regional office, your regional director and your regional leadership, your life will be much easier. The same for the positive relation and strong support from your in-country leadership. When I'm talking about in-country leadership, I'm talking about your resident coordinator, your humanitarian coordinator. In some countries, is the same person. So as absolutely essential to have a positive relation and a strong support from this or that person. And also to develop good relation and appreciation from donors. This is key for the success of your PSA plan in country. And another key condition is a close collaboration with protection and GBV and child protection subcluster. You have heard from Mariska how much is important in the implementation of survivor assistance to work in strict and in close collaboration with GBV subcluster. And I want to reiterate this message is absolutely key. There are some fruitful practices that have been implemented in Zimbabwe. For example, frequent trainings, awareness raising session to the different cluster, not only protection, but WASH cluster, food security, etc., and also with leadership, UNCT, HCT, and the different partners. Another fruitful practice has been the constant participation of PSA coordinator to ICCG and cluster meetings, participation to HCT and UNCT meetings. So the face of a PSA coordinator was always in that meetings. And regular PSA network meetings. When I'm talking about network, I'm thinking to the PSA focal points meeting, which is the network meeting, and also to keep a constant communication with these focal points, sharing tools, materials, and having a very transparent communication with these focal points and the good reporting all activities that were done. Another important practice in Zimbabwe was the participation of a PSA coordinator to HRP project scoring and approval. And part of that was also the preparation and the submission to donor of a PSA dedicated project. We have a big problem. PSA is something having costs. So we are sent sometimes in countries not having 1 cent and requesting to provide big, huge results. But to achieve these results, we need money, and we need to find that money. Why I was talking about to have good relation with donors, and also to prepare and submit credible and high quality projects to donor for PSA dedicated project is absolutely key. In Zimbabwe, we have submitted a project, and we have seen this funded. not with a huge amount of money, it was just $400,000, but this has allowed to secure a PSA coordinator position for 6 months and many PSA activities. I would encourage you to do something similar. And the last but not least, continuous learning and improvement of our own capacity and skills as PSA coordinators. PSA is technical. I want to repeat that. PSA is really technical, and your technical skills should be adequate to your great responsibility. We have a lot to learn. Don't be ashamed to say, okay, I need to learn more. I need to understand more what PSA is and how I can better, how I can improve my capacity and my technical skills. This is very important. We need to learn all the time, and we can do that through the communication with our peers, because there's many coordinators feeling and experiencing the same challenges. We can exchange our knowledge, we can exchange what we are doing, we can exchange the tools we are producing. A lot of work is going on, but sometimes we do not communicate what we are doing, and we are doing a great work. And finally, I want to highlight that PSA is also building consensus and ensuring good understanding by all stakeholders about a relative new matter. So don't forget that we are talking about PSA since 2002, 2003, is 20 years. It's not so long time, is a relatively new matter, is very sensitive and often raising concern and distrust. Our work is not easy. We are doing a difficult work, and we are building consensus on that work, and we have to support each other and be, yes, and we know that it's not easy. But this consensus we want to build should be materialized. We should materialize it in concrete action and measure, and not kept as a list of theoric statements. Yes, the theory is there. We have a lot of guidelines. We have a lot of theoretical tools, etc. But we are facing every single day the reality, and the reality is very complex. But remember, our first priority is the well-being of victims and the accountability of perpetrators, and is not to write the most beautiful, but sometimes unrealistic action plan. And last but not least, PSA needs money. No action can be done without adequate funding. If we want results, we should request and not fear to request. Yes, we need to request to donors or to the leadership or to MCT, HCT, and obtain the needed financial and human resources. Otherwise, we can achieve the results we are looking for. So this is my message. This is possible. I would really encourage you to not give up. Thank you very much, and over to you, Monica.
Maria, thank you so much for this very informative, practical, and refreshing presentation. I am sure that everyone in the audience is taking note of your tips. We really appreciate it, and you highlighted key issues. Actually, if I may, I would like to use the opportunity to inform the audience that we finally have an R4V PSA training model for all R4V partner organizations. I also loved what you said about always having in the national platform's agenda the issue of PSA, the network of focal points that you mentioned is so important, and this is an area that we are trying to reinforce in our response. You mentioned the HRP, and our equivalent is the RMRP, and we are going on the right track, as you say, in ensuring that PSAA is systematically prioritized. That's why we have a guide for the inclusion of PSAA measures in the RMRP, which Tim mentioned at the beginning of the webinar. Now, the issue of resources, and this is directly linked to the RMRP discussion, is crucial. And yes, we must secure human and financial resources to deliver PSAA quality activities. Thank you very much for all your lessons. We're going to travel back to our region, to Colombia. Catalina, you have in your hands the leadership of interagency PSAA activities at the country level. You have worked alongside the R4V Platform or the GBV in Colombia. And the PSAA network you lead has just finalized the SOPs and is in the process of rolling them out. What lessons have you learned in this process? I am sure that everything you share with us will be very useful for the countries listening. The floor is yours, and thank you very much for being here. Thank you very much to the coordination of the platform and to all the technical colleagues from the PSAA COP. And thank you also to R4V and to all my colleagues who preceded me in their excellent presentations. I would like to tell you a little bit about the process. Maria has already described the challenges we face and we undertake this task, especially in Colombia, a country where many humanitarian agents come together, not only due to the humanitarian response derived from the context of the internal armed conflict and the provision of attention to vulnerable populations living in poverty, but also to factors within the framework of development work and migration flows. The attention provided by the work of GBV, the R4V Colombia platform, and additionally the presence of a political mission, the verification mission in the country. This is a process that was first established by the PSAA task force in Colombia. We included the link in the presentation for future reference and to give a context of how we work and how we are rolling out this document and these procedures. I would like to mention that the PSAA task force in Colombia is integrated by the entities of the UN system that you see here, with the co-leadership of UN Women, UNICEF, and the members including the Verification Mission, UNDSS, UNHCR, the World Food Programme, UNODC, UNFPA, IOM, and UNDP. We also included the GBV's logo because we have PSA focal points that participate in this space and guarantee that we have a good articulation with the platform. I would like to talk a little bit about the development process and those recommendations that were useful to us, even though it was a long process. Let's say it was very interesting to reach a consensus and agreement. What was useful to us in this case? In the first place, having the IASC Best Practices Guide as a reference was fundamental to be able to structure guidelines and to be able to structure the step-by-step that we should consider. In addition, we reviewed the SOPs of the countries that share them with us, including those of Mozambique, Venezuela, and Sudan. And it was also very interesting to be able to have direct exchanges at the time with the PSAA coordinators in Mozambique and Venezuela. What happened in this process? We were preparing the document, but at the same time we had to keep in mind the different guidelines and orientations that each of the entities within the system had. So we also reviewed the internal SOPs of each of the members of the task force who shared them with us. And we had 7 feedback sessions with the members of the task force. So this document was being reconstructed with everyone's opinion. What else did we have, and what was also a great advantage and support? We had some workshops that we led from the task force. And here we had a special support from UNICEF with experts at the headquarters level and also from Latin America, including Catalina Fernandez, who is here and also supported us. And we also had the participation, the experience, and the recommendations of the coordination of PSAS in Venezuela for everyone in the task force. In this process, we adjusted our wording, considering the multiplicity of agents we have in Colombia. What we now want, which will be a great challenge, is to be able to bring to life what we have in writing and what we are rolling out to the different territories within the country. We also had a review and approval phase by the representatives of UN Women at UNICEF, who are co-leaders of the task force. So it was very useful for us to have their endorsement and review. That is not only from the technical team's point of view, but also at the leadership level. And then what did we do? We had a review by all the UNCT representatives. And during this review time, we also had the opportunity to receive their input and officially approve this document. Regarding the time frame, this was a long process that started around April or May 2020. And as you can see, we finally got approved in April. I'm going to follow the structure of the document, even though many people are already familiar with it, thanks to the general IASC guidelines. First of all, its general objective is to establish common procedures for the entities of the United Nations system and humanitarian and development NGOs that are implementing partners of projects and programs to ensure not only the reporting of cases or suspicions of SEA, but also, as my colleagues mentioned earlier, an adequate referral for assistance to survivors of SEA. Speaking of the specific objectives, this common procedure includes, on the one hand, how the information about cases or suspicions of SEA identified should be shared when 1. Identified through the official internal reporting mechanisms of individual agencies should be exchanged, these mechanisms that Mariska mentioned, or 2. Identified through community-based complaint mechanisms available to the communities to ensure they are addressed in a timely, confidential, and safe manner when they require interagency management. That is, when the cases apply to different agencies. On the other hand, it defines procedures and measures for when there is a case of suspicion of SEA committed by personnel of the UN system or the personnel of any of their implementing partners, which involves several entities of the UN. In addition, we also define roles and responsibilities for the actors of the UN system and of the implementing partner organizations in the implementation of the Interagency CBCM, which at the moment is a pilot. What do we want? First, we want to establish a pilot after rolling out the SOPs. Why a pilot? We want to be able to really put together the pieces of what this interagency community complaint mechanisms would be in a specific location, and to learn what additional factors to this procedure described in the SOPs and what modifications to safe referral to victim assistance services we should consider to make sure that we can say we have an interagency community-based complaints mechanisms in the field. I should say that another thing we did was to contextualize the UN Victims Assistance Protocol, focusing on survivors of SEA, and develop an annex to the SOPs. The annex is a protocol with operative guidelines on how to refer, assist, and adequately care for SEA victims in the country. This document was written with the support of the gender-based violence subsector in Colombia. Moving on to the scope of the SOPs. The scope, therefore, refers to 4 types of cases or suspicions of SEA of an interagency nature. First, those that are known by an entity of the UN system organization, different from the UN system entity or organization to which the alleged perpetrator belongs. Cases also involving several systems entities because the alleged perpetrator is part of the staff of an implementing partner organization of several UN system entities or system funds or programs. Those cases mentioned by my colleagues in which the UN organization of the alleged perpetrator is not identified or specified, and the guidelines to know what steps to take in SEA cases where the alleged perpetrator is part of a supplier or subcontractor that involves several system entities or partners. What does this document not contemplate? It does not provide guidance on SEA cases that are not interagency in nature or cases that are not perpetrated by UN system personnel or personnel under contract or in association with the system. Nor does it address those cases of sexual harassment committed in the workplace among UN system personnel. The SOPs contain in detail with specific guidelines on the steps to be taken in 4 cases I just described. It has guidelines for referral to GBV assistance services when the cases 1 are reported by the victim themselves or when they are reported by a third party. Additionally, it contains some guidelines for reporting in the official internal mechanism. It also includes the steps that we should follow to manage a case of suspicion of SEA that involves different entities of the UN system organizations, as well as some forms that should be used for that based on IASC guidelines. Finally, it outlines the circumstances in which cases are communicated to the PSAS task force, in this case to the interagency coordination, or in the absence of interagency coordination, to the person that the task force delegates for that purpose. What did we want to include in these SOPs? Unlike other countries that have other types of mechanisms, many times when we have been asked how many SEA cases we have in the country or what our panorama is, we could not provide this information. We could not see the whole panorama. Why? Because the cases were previously handled by the focal points and from the entities of the system independently. What did we write in these SOPs? Let me start by making it clear that only the request for information is made to the entities of the system in Colombia. A request for information without personal data, meaning anonymized, both for the surviving victims and the alleged perpetrators on cases or suspicions of SEA, not only in an interagency manner, but also the internal cases that are being handled by the entities of the system. With what objective? As a task force, we want to have an overview of the country and the areas where these reports are being made to develop joint recommendations and mitigate SEA risks, and additionally identify the need for assistance, monitor access of survivors to GBV services, and also develop recommendations on measures to prevent SEA and provide assistance. We wanted to know what services survivors are requesting and also if there are barriers to access, in which case we have to do advocacy. Who handles this information and who has access to this information? For peace of mind of people joining us today, this information is only received by the interagency coordination, in this case me, and is shared with the resident coordinator, who is also currently the humanitarian coordinator in the country, so that she can establish reading and make decisions with this data. My last slide is about lessons learned and the next steps we're taking. On the one hand, and this is something that Maria also mentioned, the lessons learned are to be a little bit realistic with the times of development and feedback. Sometimes we want to do a lot, but we know that when it comes to interagency issues, there are time frames, and sometimes they take longer. And what we wanted at the time is to have everyone's participation and consensus. The level of detail of the procedures was very important for us to be able to establish an ABC of the minimum that should be followed and considered. That is to say, a detailed step-by-step. The support of UNCT in the elaboration and participation process was also key for us, as well as that of the co-leaders of UNICEF, UN Women, and UNHCR, and also to be able to hold workshops in a participatory manner. I believe that these conditions were very important. Of course, the key is the articulated work with the GBV subgroup, and now we are looking at the financing that we must have to be able to roll this out. And as Maria said, it is key to obtain resources that allow us to achieve our goals. We have a technical team, but sometimes we also need to be able to promote it with an operational team to help us and support us in the goals we have set within this action plan, which is, of course, the rolling out of the SOPs. We have been creating awareness of the document. First, we started at the country level with a country humanitarian team, with the national GIFM, with the coordinators of the local coordination teams and local GIFMs. And now we are in the process of sharing it also with the stakeholders at the local level. What do we want to follow up on, and how will we know if these SOPs are implemented? We have the support of UNICEF in the process of developing user-friendly material, i.e. not only some workshops, but also something that allows us for easy reading and appropriation of the contents. And additionally, we are in the phase of developing the annex of these SOPs, which is the assistance protocol. We are in the phase of approval for subsequent rolling out with key actors. And what do we want? Well, once we have laid the foundations with the SOPs, we want to enter a pilot phase of IA-CBCM. Thank you for the space, for your time, and well, we look forward to your questions. Thank you very much, Catalina. It is incredible how all the topics are coming together, and we have arrived at these two experiences where we get a sense of the operationalization of survivor-based approaches, victim assistance, with your contextualization of the protocol in Colombia, and interagency mechanisms. We are very grateful to all the panelists because there is an impressive amount of expertise gathered in this panel and a great diversity of perspectives from which we can learn so much. We are running out of time, and we want to allow the participants to address a couple of questions to the panelists. So, Catalina, Valentina, go ahead and guide us through this last section. Thank you very much to all the participants in the audience today. We are going to open a small space for questions. Please feel free to ask questions in Spanish, or if you want to raise your hands over here, let me see if we have anybody.
Hi, everyone, and thanks so much for this great session. Well, my name is Elena, and I'm currently the regional focal point for the R4V platform for accountability to affected populations. So a theme that is very closely related to PSAS, and I loved very much that there were references to accountability throughout the whole of the session. So I'm very great to see that really the work that me and Monica have been doing over the past few months to closely link the themes together. It's something that resonates in the sector and hopefully will be as successful as you have done in other contexts. I have a couple of questions. The first one is about interagency mechanisms. And as you know, R4V is a platform that incorporates members and partners from all types of backgrounds and specialties. And so how do you start working on interagency mechanisms where you have a variety of actors that perhaps already have their own mechanisms, some do not have mechanisms, and they are all at different stages of the journey? So how do you unify that landscape, and how do you make sure that different agencies abide to one single interagency mechanism? That is my first question. And then the second question is about funding. I very much like to hear that there is a connection to funding, which always, or too often, unfortunately, gets forgotten in this type of work. So what have been successful strategies to secure funding for this type of work? And really practically, what has worked, what angle, and how did you do it? Thank you so much.
Thank you, Elena. I think there is another question from Tim. Yes, thank you so much. I'm going to ask it in English.
Yeah, thank you so much. Super interesting indeed, as Monica said, a little bit in line with what Elena said. And I don't know, maybe this goes back also to you, Amit, and Mariska. I'm wondering a little bit, because I think maybe one important clarification for us is, of course, that, and we spoke about this in the last webinar, that for R4V, when we speak about the humanitarian coordination and the country teams and the RC responsibility, in a way, this is different for us. Yet, as Elena, and I really like Elena's question, the question on how do we ensure good synergy, how do we not do all the same, but yet follow our mandates? And I think maybe if you can add a little bit on your presentations. I mean, you mentioned like the training approach. How do we, particularly in this region for R4V, basically the accountability, if we want to draw a parallel to the role of the RCs, for example, would lay here with the IOM Chief of Missions and the UNHCR representatives, who are the representatives and who are the platform leads at country level, and then we have the same regionally reflected. So a little bit on when we speak about victim-centered approaches and training approaches, do you have any recommendation for R4V? How at this level of accountability, but linking to all the content that we heard about, what are some of the good examples that you see, in addition to all the necessary technical work, to really get that leverage at the more political and accountability level? That would maybe be a little bit linked to the question that Elena asked. Thank you so much.
Thank you, Tim. And I think we still have time. I give you the floor, Valentina. Okay, Catalina, we have a specific question in the chat from a participant who mentioned the following: taking into account the diversity of organizations that are part of R4V and that the community-based feedback mechanisms have different ways by which they can receive feedback from the affected populations, either through boxes to submit complaints, interviews, group processes, etc. What practical recommendations do you offer to ensure the confidential handling of information, taking into consideration the sensitivity that a complaint related to SCA incident represents? Over to you. Well, this is a great challenge for us, Elena. Something we have been doing in Colombia that has helped us in our experience is to conduct surveys with the different members of both the humanitarian country team and the GIFM, because here we have the two coordination spaces to inquire about these complaint mechanisms by asking some key questions about even the same guidelines we have at IASC level, and also accountability to affected populations to know if they are safe and confidential, but additionally, if they have some parameters and if they have been rolled out in the communities, because it can also happen that the mechanisms are in place, but the communities do not know about them. We started to document this last year by enlisting the members of the PSAS network. Here we have a network that actually does not have a formal action plan, but it is a space, a community of practice, if we can say so, that has been promoting since last year in the task force to have the participation of all the NGOs that want to be part of it. Not only the entities of the system, but also the NGOs. And then we ask these focal points of the PSAS network about these mechanisms. What has happened to us? The gathering of information has not been so easy. And that is why we thought to ask exactly how they were guaranteeing security, to ask exactly what type of mechanism was used. We see that in the country with the information we have, there are several telephone lines. We also see that there are children and teenager-friendly mailboxes. We have good experiences such as that of Bethany, Save the Children. The WFP helpline is also a good example of what using this mechanism and rolling it out with the communities can be like. But also it is often difficult to know how we guarantee a differential and gender approach when talking about these mechanisms. Of course, in this brief overview that we can also share the document we have about the mapping that we have done, we also decided to include in this new action plan 2021-2022 a national characterization of all the mechanisms, to know exactly where they are located, to know exactly who is managing and leading them, and to know if they comply with these parameters. With what purpose? To be able to elaborate recommendations for the country so that the different members that do not have mechanisms or that have them but need to strengthen them can take those recommendations. And for this, we have also been inviting the organizations to the different bi-monthly meetings that we have with the PSAS network to share their experience and how they are managing them. Well, I'll stop here, but if you need further information, I would be very happy to provide it. Thank you. Thank you, Catalina. We give the floor to Mariska, Amit, Ivana, Maria, if you want to expand. Mariska, go ahead.
Thanks so much. Really excellent questions. I would like to maybe go into, I think it was Elena's first question about how do we make sure that, considering that there's a wide variety of actors and how to use complaint mechanisms of other actors. So within the kind of referral pathways that we are advocating for, the good thing is that we don't need to set up new complaints mechanisms. within that system. We use what is already there in terms of complaint channels. And, you know, one organization can have multiple complaint channels that beneficiaries can choose from, but it can also be that within a certain context that there is a jointly operated, what happens sometimes, a jointly operated hotline to save money and resources. And, you know, all of those different complaints channels, or any way that we can receive allegations of SEA. And by the way, those complaint mechanisms, they don't need to be specifically for SEA. They can be broader AAP mechanisms that have SEA, that know how to handle SEA. So having those different complaint channels and those different ways of receiving allegations is so important, because we just see that the chances get much higher that we get a lot of complaints, and making sure that anyone at country level knows how to refer the allegation to the appropriate organization for follow-up. That's the most important thing. So I think it's more about making sure that people are aware of like the standardized procedures to refer the allegation than necessarily you know, having to make sure that all organizations use the same complaint mechanism, because that's just not what's happening in reality. Different organizations have different complaint channels, and we should continue promoting those and adapting them to the needs of our beneficiaries. That should be the priority, and definitely work with what we already have, because so much good work is already happening. So that would be in short my reply. Thanks so much.
Thank you, Mariska. We continue with Ivana and then Maria. Go ahead, Ivana.
All right, thank you very much. Great questions, colleagues, and also great presentations from colleagues on country-specific approaches. So in response, excuse me, to questions on confidentiality and how do we do that, given that we are working in an interagency sphere. Many different actors are engaged, a lot of information is being collected, passed around. So how do we do this safely? The confidentiality really should be the gold standard and the number one principle that we all follow. And so this is why we're actually advocating and why it is so critical that we work together, the PSAS sector with the GBV sector, to make sure that the victim assistance referral procedures are integrated in the standard operating procedures. And this is important so that everyone is working with the same framework and has an understanding of exactly how the process should flow, what information should be collected, how information should be transferred, from whom to whom the information should flow as we support. And again, at the very center of the response is the support to the victims. And that should guide our process. So it is important that the description of the principles, including spelling out confidentiality and all the other important principles, are included in the SOPs, so as to give a clear guidance for partners engaged in the interagency mechanism on PSAS. What are those steps and how to ensure confidentiality of all concerned and involved individuals, the victims as well as the complainants. It's not always the same person. The complainant could be someone else. And we should really work towards ensuring that that information is safeguarded. So also including guidance around information sharing. So not necessarily having to have a separate information sharing protocol, but that information could be incorporated in the whatever existing SOPs there may be, CBCM or the PSAS platform SOPs. And that information that's being gathered really should serve a specific purpose. And that purpose is to ensure that the victims receive assistance. The information gathered and transferred is not for the sole purpose of reporting. So really keeping that in mind and outlining from the get-go what is the the process and the principles that we should all abide by, and how the information should flow. And there is a requirement to notify in country the senior head of mission, whether it's RCHC, on the PSA or SCA allegations. And that can be done without disclosing personally identifying confidential information. So the focus could be providing the minimum necessary information that would help us achieve whatever the next course of action is, to provide assistance and any other actions related to the case.
Thank you, Ivana. We also have Maria and then Amit. They are going to expand on the questions. Go ahead, Maria.
Thank you very much. No, Ivana, she said already a lot of things was in my intention to say. I just want to highlight that in Zimbabwe, for example, yes, we have included the information sharing modalities in the standard operating procedures. In other countries, people prefer to have an information sharing protocol. What I want to suggest, this is different from a country to country, that depends on many factors. What I want to highlight is the need to be as precise and detailed as possible for each reporting channel you have. If you have an email as a one of the reporting channels, you should clarify to whom this email should be addressed, who will be copied, who is every single details. This is something which can minimize the risk of leaking the information, which is very, very common, unfortunately. Confidentiality in CA and PSA and GBV is something we are talking about since decades, and we never reach, for many different reasons. So we never reach the 100% of the confidentiality for cultural reasons, for many, many different reasons. But to at least to take under control the minimum requirements, really don't fear to be as precise and details as possible. So just to really decline who is the recipient, who can be copied, etc., in every single thing. This is my suggestion. But my colleagues have already explained much better than me about confidentiality. What I would like to answer is about funding. You will be surprised to see how much donors in that period, maybe in 1 year time will be different, but now we have to take advantage of this very positive momentum, how much donors are interested and keen to provide money to PSA. Donors are really looking for that. I think it's our responsibility to present credible and realistic projects through the UNCT or directly to donors, because we can also have directed negotiation with donors. And you will see that donors are really, really hoping to provide money to PSA. So please keep this momentum. Of course, we need to present credible projects. Sometimes it's also our responsibility because we are not able to present credible projects. But otherwise, donors are really ready and really open to give us money for PSA. So we need to try to take advantage of this very positive momentum. This is my message. Thank you very much.
Amit, we'll go to you. Amit, let's go with you.
Thank you very much. Really wonderful questions and great responses. I wanted to answer a little bit Tim's very good question about engaging leadership and securing commitment. at that level, because I think several panelists said how important it is to have our senior leaders committed and engaged. And that goes, I think, to everything from setting policies to implementing them, to establishing SOPs, to securing and advocating for funding. So there are a few resources. The first is a learning program on sexual misconduct, both SEA and SH. And the audience is all humanitarian and development actors and partners. So it's for everyone. And the goal is to get everyone up to the same fundamental baseline, to understand these concepts, the policies, and their obligations, and to do it in a way that is engaging. It's actually through videos and fictionalized case studies that are based on an amalgam of real situations that really seek to engage people with how they would respond in a real life situation, rather than just quoting rules and asking people to follow them. The next one is quite interesting. It's recognizing that we have a problem with culture. We have a problem with gender inequality. We have a problem with power disparities, abuse of authority, abuse of power, and we need to look at root causes, and we need to engage our senior leadership themselves in critical self-reflection. And in fact, we need to engage our entire humanitarian workforce in a critical self-reflection on the kind of power and privilege we hold, and how to be more aware and more responsible in how we exercise those privileges and those forms of power. So we have a report on promising practices in changing organizational culture. And I can provide the link if it's not working. The other thing we have, which is interesting, it's also Interagency, is a fund to support community outreach and engagement, because many people said that communities themselves, people in crisis, aren't aware of their rights. They aren't aware, or we have not discharged our responsibility to communicate in an effective way that assistance and protection are human rights. They're never conditional on anything. Money, exchange, SEA, never. But one of the things, and I want to come back a little bit to reporting on this last point of community engagement, is that it's one thing to establish reporting channels. It's another thing to actually verify that those mechanisms meet local and diverse needs. Are they reachable? Are they accessible? Do they feel safe? Do they feel trusted? If we have a hotline, do people have phones? If people have phones, do they have data? If people have data, do women have the same access to data than men? Or could disparate access to data itself cause other risks? Could it put other pressure on women to get a phone or to get data? Are they accessible or appropriate for people with disabilities or for people who are LGBTQI? I think the only way, honestly, to know this is to engage with affected people, engage with people in crisis, in a diverse array of people in crisis, and to seek their input. And that goes back to the victim-centered approach, which is to listen, always listen, and really adjust on that basis. One other element I wanted to speak to very quickly is to essentially just try to reaffirm what Ivana said, and I think Maria seconded, which is the importance of drawing from our expertise that we have from our GBV colleagues and child protection colleagues around the importance of confidentiality. When we gather these disclosures, as I think these colleagues said very well, it's not to generate data for the sake of generating data. It's to ensure accountability, but really to ensure access to necessary services and assistance in line with the individual's informed consent. So we can't lose sight of the very important data protection principles. We share what is necessary, not beyond, on a need-to-know basis with the individuals who need to know, meaning those individuals who need to take an action on behalf of the victim or the survivor, not somebody who simply wants to have data because it's interesting or because they genuinely want to help. It has to be necessary, proportionate, and limited in purpose, and limited to whom and how it's going to be used. And we need to explain this to victims and survivors. We need to follow those principles and protocols from the GBV sector, where they have really strengthened the management of data sharing in protection-sensitive ways. Thanks.
Thank you. Thank you very much to all the panelists. We are conscious of the time, so I will give the floor to Valentina to close this part. Thank you very much, Catalina. Once again, thank you very much to the panelists for expanding on these questions about leadership, interagency coordination, funding, confidentiality. And I love how Amit once again took up the principle of always placing the survivor at the center of any action or any intervention or any step that we are taking. I think that concludes the Q&A session, so I will give the floor back to Monica. Go ahead, Monica. Thank you very much. And well, Valentina, you just picked up on what I wanted people to leave with. That is the survivor-centered approach so that we never forget it. Picking up on something very important that Maria said, that PSA is still a technical area and that we still have a lot to learn in the region. I hope that opportunities like this webinar continue to be useful to keep ourselves updated on the R4V response, to keep learning, and to keep sharing the lessons that we hope will also draw from this region. So we thank you immensely for your participation and for sharing your expertise so generously. To the people who are watching us, we thank you very much for being here. The contact information for our regional community of practice on PSA will be on the screen below, and we encourage you to contact us with questions. We are always available for technical support. Thank you very much. It has been a pleasure, and we hope we will be able to hear from our panelists in the future. Thank you and have a good day.